Good afternoon, everybody. I have two questions I want to ask. One is about a
We can't hear you
college.
anymore. Okay.
We finished from the same college, but last week I got a news and I saw the picture. She has a breast cancer. The two breasts was cut off and in a critical condition. Now I was about mentioning to my colleagues, I mean in our school page, that I want to introduce a ABBA product. But time again, I was looking with the condition that they reported. I was thinking, so I want to ask, can in a case like that, the two breasts have been cut off. In fact, she couldn't talk very well when they showed the audio something. Is there any other product that we can recommend for her? So that is the question I want to ask.
Okay. I can't see her. I think maybe she's off her system. But if I can quickly attend to you, and I'm sure many people can attend to you here as well. But we had a case that we pushed out yesterday. I don't know if you saw it. There's a case we pushed out yesterday of somebody with breast cancer, who has been for 1 month on Rita bitters, and they just upgraded her to adding cleanser to it. Okay, and she's looking much better already. The pictures, if you go to the push groups, if you're on the push groups, you'll see a video. It's 1 minute 31 seconds,
Yeah.
I think, that shows you the case of that lady. So she's been using bitters and cleanser. Okay, I have another case. That one was from Dr. Philip. I have another case from Mrs. Dupe Dupe. This one has been on radar bitters for the last 6 months. She had, very, very bad on one of her breasts. We got the pictures for this as well, because as they were doing and making progress, they were sharing with us. And even the look is not as exciting as the feedback from the person using the product. So normally these things come with a lot of pain and a lot of stress. So the person says the pain is relieved, they are feeling better. Some of these things have almost, you want to die, you want to end it quickly. But their lives are more bearable. They're having a better time managing the ailments. The wounds are not looking so soggy anymore. The parts that were hard before are softened up now. And one of the people, the Dr. Philip was saying that we should tell them that they should upgrade. They should begin to use Reader to cleanse the site of it as well. So for this person who has already done an operation, that is a good thing that they've done an operation. At least they tried to remove the malignant tissue or the cancerous cells. I don't know how effective that has been, but yes, Reader, they can drink Reader, they can apply topically, and then they can upgrade to adding cleanser to it somewhere along the line. I'm not sure if there's any other doctor that wants to add thoughts to that, but this is how the cases that I'm familiar with have been taken care of. In one of the cases, they also try to use disinfectants to clean and all that as well. So you can reach out to the person and let the person start with Reader, and then as soon as they get comfort, it's helping with the pain and easing all those things, they can upgrade and add cleanser to it as well.
Yes, I'd like to add a little bit to that. Thank you, CM. The reason why the person can and should also use Reader is, apart from even the fact that the tumor has been removed, if there's no metastasis yet that is spread to other organs, Reader can prevent it, put the person improve the person's immunity to be able to fight against possible metastasis and deterioration. So yes, I think it's a good idea. It's like CM said, it's good that something has been done, the tumor has been removed, the breasts have been removed, but I think it's the perfect time to use Reader and possibly cleanser as well.
Thank you.
Chikodi wants to speak as well. Chikodi, you can unmute. I can see your hand up. Okay, Chikodi. We can hear you, but we're not hearing you.
Seems there's another person, Latifat Faoli. Maybe the person can speak for, can go ahead.
Okay, good afternoon, everyone.
Good afternoon, ma'am.
Thank you, Hermai, for the great lecture. The content was so great. My question is, one of my clients that has used beta supplements and beta fire, he actually had given me his feedback that he's actually working well. He called me this morning that his uncle had just been diagnosed with stage 1 prostate cancer. So I want to ask the doctor in the house, though I've recommended Herbal supplements.
I think we lost her voice here.
With his chemotherapy, because they are making steps at the hospital to start him on chemotherapy. So I want to know if it can be combined. Thank you.
Thank you. I would advise that before the chemotherapy, he should use it. He should use, and then after, start back on it. I would not, it also depends on how many sessions, maybe in between sessions, it can be used, but not simultaneously. That's what I think, yeah.
Okay. Okay. Thank you very much, Mrs. I hope that's clear.
No, not at all. I didn't get to our point.
Okay. I said that if they're planning for chemotherapy, I would say he should start it immediately.
Okay.
Start using it, the reader bitter, it's my reader bitters and fire for the chemotherapy.
Okay.
Yeah. And then depending on the intervals between the chemo, yes, can use it before and after, and after.
And
yes.
after. Okay.
Yeah,
All
that's
right.
what I would suggest.
Right.
But definitely start now, because you could find, it could be found that, excuse me, that if he's used it for a while, there could be changes in tests, in the results of the test, even before the chemo has started.
Okay, ma. All right, doctor. Thank you.
Okay, ma. Chikodi, can you try now? Chikodi, can you try now? Okay, Yalwati. Yalwati, you can start, you can try.
Good afternoon.
Good afternoon, ma.
Please, I have a cancer patient too. She bought 2 bottles of the 250 ml bitters. But when she started, I think she just took it for about 4 days. She just told me, as if the case has worsened, she has a lot of pains, this and that, she wants to stop it. I told her, no, she should exercise patience and continue. She can't with the way she feels, this and that. I told her most of the times is when the supplement is working, that's when you have those pains. But if you try to continue, with time it will stop and you get what you want, the benefits. But she told me that no, she can't continue. So I want, what advice do I give her? Because I advise her to continue. There's no harm, there's no side effect. But she told me since then she stopped using it, but she didn't return. I told her, okay, let her return it, I'll give her back her money. She said no. So what advice do you give me to give her?
I guess we need to know more about her. What's the cancer? How long has she had it? What treatment is she having? How is the treatment? So a lot more, maybe a lot more questions need to, be asked about that.
Okay.
Yeah.
Okay.
Then, the response would be after considering all those. How old is she?
What dose is
Yes.
she taking currently?
Yes. What dose of the reader?
Does she need to dilute?
Yes,
I don't
because
know.
she told me she has ulcer, so I told her to be diluting before taking.
Okay.
What cancer is it?
Cancer is she exactly? I was just going to ask.
Oh yes, I don't know. I know it's not breast, yeah.
Yeah, it's good. It's good to have all that information.
Okay. So if I find out, where can I throw the question? Or where should I say
The
the
FAQ
response?
group. The FAQ group, ma.
Is
We
it
have
the
frequently asked questions on Telegram. Yes.
Telegram.
But whenever I ask questions on Telegram, nobody answers.
We
I have to
answer
go.
questions there every day. Questions are answered there every day. There's no question in the Telegram group that doesn't.
Okay, Eloma. So what you do is this. In those groups, it's not instant answer. So once you ask your question, just leave your question there and check back there.
Okay, thank you.
It will be then attended to. Also, and I think this is very important as a preparation for tomorrow's class. So tomorrow's class is going to be Dr. Fumi Aino's class. One of the key elements that will be featured in that class is making sure that the questions to ask, many times we are too much in a hurry to quickly give prescriptions when we have not done enough to obtain data. How old is the person? What is the person's weight? What other drugs is the person using? How is the person using them? What exactly are you feeling? What's the challenge? There's what they call healing crisis, but we need to understand what exactly is happening. Is the person having pain? Is the person going to toilet? What exactly is the issue that the lady is raising? So when you are able to collect as much data as you can, so that once somebody wants to look at it, this is able to understand, okay, try this. The things that will be asked to try will be a function of really obtaining sufficient data about the person. So tomorrow's class is a no-miss class. This class can only take 100, so come on time so that you're in. You can listen and learn, and all those who can make this class, they will make it on YouTube.
Okay, thank you very much.
Well done.
You're welcome, ma'am.
Chukudi, last question. Chukudi, you can unmute now. Hello, Chukudi.
Chikodi.
Sorry, Chikodi.
Yeah, I think we can hear you faintly, but you need to increase your volume.
My question is, I have someone I will predict fire and
face the light. Face the light. Don't back the light. Face the light. Face where the light is. And increase your volume. Good. Yes. Then increase your volume.
I have someone that I will predict fire and bitters and fire. Regarding the issue of election, I go personally well in the game. So, as I go through those things, that the taking getting 16 months now. Then you were telling me that you are not doing results later, that you stop eating. I don't want problem of having to kidney and other things. Because they want to have the benefit.
Hello, ma. Hello, ma. Hello, Mrs. Chikon. We are struggling to hear you, but we have heard a little already. But we are struggling to hear you. I think I can hear that there's somebody you recommended fire and bitters to, and the person, after 2 months, said he hasn't seen the results yet. Is this correct?
Yes.
So what you need to do is this. I'm going to allow Dr. Fumi to answer, but I'm sure if I understand a little of what they are doing and what happens, you need to, what exactly is the person's problem? Has the person gone for any checkup?
Yes.
What exactly is the result of that checkup? Is it weak erection? Is it no erection? Is it low sperm count? Is it no sperm count? Is it what exactly is the challenge, and then what has been the experience for the last 2 months. So basically you want to get the data. We're not hearing you very clearly. It's a struggle to hear you. But if this is the issues, you want to collect as much data as possible. I don't know if you heard anything, Dr. Fumi.
I actually didn't, but just like you said, we need a lot more information, because we don't really know what is wrong with the person. We just know that he's using reader bitters and fire. So if she gets all that information, then we can discuss later.
Okay, so bring it to the FAQ group. But try and increase your phone volume so that we can hear it.
I mean, sometimes people don't even, Doctor, I already said it. When we don't ask the right questions, we would recommend wrongly, and expectations will not match what we're recommending. So it's important. Like Dr. Gumola is asking here, is it low sperm count with infection? The person had prolonged infection, and needs to maybe use cleanser for 30 days, and that is not in place, the effect may be delayed and things like that. So we need to ask the right questions to be able to recommend appropriately. So, yeah.
Mr. Okoragba wants to ask a question.
Okay, good afternoon, everyone. It's not actually a question, sir.
Okay.
Hello. It's just in response to the lady that talked about the person experiencing cancer issues before this lady. My response is I wanted to just respond and let her know that most times body chemistry differs. And usually before now we were told about healing crisis. Sometimes before the product gives you the desired result, you experience some discomfort. Like many a times I've had experiences from people that has high blood pressure and all that. Usually when they start reader bitters, they keep complaining that their blood pressure went up. So in response to that, we tell them that in as much as they're taking their normal medication, they should still continue, because if you discontinue, you just go back to the same. But as they continue and obey, you discover that they begin to get the desired result. So usually, once you introduce, most times when you introduce reader bitters to the body, you definitely, some people might experience some natural discomfort. But the idea is they should continue on the bitters. That's just my contribution, sir.
Okay, well done. Okay, so I think it's a good place to pause today. There will be 1 week of doing this, so there will be opportunities to ask plenty of questions. The last day will be dedicated, there are 2 days of conference, or 3 days of conference that will be dedicated to question and answers and discussing the issues, discussing the topics. So we'll wait for those ones. Thank you, everybody. I think we can close today's meeting and catch you again tomorrow, same time at 2 p.m.